Alrighty, good evening, everyone, and thank you so much for joining us. We're honored tonight to have Dr. John Pigott speaking to us about pre-purchase headaches in the sport horse. Before we get started, just a few announcements. Our next session will be on May 16th with Dr. Toby Pinn presenting on vector-borne equine diseases. This session tonight will be recorded. And it will be posted. You should be emailed a link in about a week to the recording. As a reminder, my name is Kelly Nickelbein. I'm a clinical ophthalmologist here at the Equine Hospital. I'm relatively new to the seminar series and happy to be here and excited to be involved. And very excited to introduce our speaker for this evening, Dr. John Pigott. Dr. Pigott is a 2009 graduate of Cornell's College of Veterinary Medicine. He's an equine surgeon. He did his residency training at The Ohio State University and has done quite extensive research in equine orthopedics, regenerative medicine, as well as upper airway disease. He's been at Cornell Ruffian Equine Specialists since 2016, where he focuses on lameness and orthopedic surgeries, as well as airway surgeries and pre-purchase exams. Interestingly, Dr. Pigott has an extensive history as a competitor in the hunter-jumper world, and that provides a really unique view to his clinical cases as well. So welcome, Dr. Pigott. We're all looking forward to your talk.
Great. Thanks, Kelly, so much for the introduction. Appreciate it. Yeah, thanks very much for having me. I'm very excited to take part in the monthly seminar series. And, when we were talking about a potential topic for this a while ago, I thought that, what's a nice topic that people, come springtime here are facing. Everyone's getting out there, riding their horses again, potentially buying horses again, selling horses. So, the genesis of the title is, both from the veterinary buyer and seller side, in the sense that pre-purchases can be, major headaches, depending on what's found and some of the detail that goes into it. So I'm going to touch on some of that throughout this talk. And, if there's any questions, feel free to put them in the chat, and these guys will help to field with whatever we can answer. So anyways, at Cornell Ruffian, I'm down on Long Island. It's a satellite facility that Cornell has, and here we do a lot of advanced imaging work, MRIs, bone scan, lameness work, both in warm blood, the warm blood population, and local thoroughbreds. Naturally being near Belmont Racetrack. We do a lot of orthopedic surgery, a lot of standing airway surgery, and Cornell's been some of the pioneers of that. And more. It's just some of the stuff that we do on a routine basis, day in and day out. So anyways, the goal for the talk, we're going to talk about what's the goal of a pre-purchase exam, how, roughly how I approach a pre-purchase. Some of that might be a little bit heavy in some of the veterinary terminology. I'll try and decipher some of that for some of you that don't know the terminology. And then some challenging situations that we end up in, both from a veterinary perspective and then, as vets, trying to explain that to the buyer as far as potential levels of risk with that. So, remember that when you're doing a pre-purchase exam, you call a veterinarian out, you say, I want to do pre-purchase, I want to buy this horse. Really what it is it's a single day assessment of overall health and soundness at the time of the exam. So that's at the time of the exam. Everyone, asks to make a longer term prediction about, really what is the assessment of risk if I buy this horse based on the findings at the pre-purchase. And that may be risk of the horse staying sound with a certain exam or x-ray finding. That may be, for example, a risk of a bump or something on a horse's leg turning into a problem. By no means is there ever a guarantee from a veterinary perspective that comes with a pre-purchase. A pre-purchase is information, and it's trying to provide you with that veterinarian's opinion on risk with certain findings. There we go. So anyways, the old adage of pass fail on a pre-purchase, it's not really a thing, anymore, at least. People used to think, oh, the vet failed my horse, or the vet passed my horse. And it's, case in point, people buy lame horses all the time, or horses with very risky conditions. And there's a variety of reasons for that. Maybe that horse has a, several year history of a proven performance or show record, or maybe it's, the only horse that matches the rider's attitude or their ability level, and they seem to mesh, and it allows you to overlook, some other things. Or maybe there's an x-ray finding, but these guys have x-rays, serial x-rays over the last several years that show no progression. So there's a variety of things that can come up, and situations that can come up that would tell someone to buy a horse despite, a risky finding. But then the opposite also rings true. Sometimes people pass on horses that may be totally suitable, but there's a relatively mild finding. For example, I have heard directly, I had a horse with navicular, therefore I want perfect navicular x-rays, whatever the heck that means. And we'll talk about that a little bit more, about how ridiculous that is later in the talk. But, I had a horse with kissing spine, therefore the back needs to be perfect. And, there's always these little, idiosyncrasies that go with the different pre-purchases based on people's experiences. And that's, fair enough to be weary after you had a bad experience, but sometimes that can be very challenging, to really weed out all of those issues. This horse with the yellow eye, this is a case that I was doing a pre-purchase on in my last job, and I literally showed up and the horse has a yellow eye, and I told the buyer, I'm like, your horse's eye, the horse's eye is yellow. I think it's having a uveitis flare up, inflammation in the eye. And she's like, I really like the horse though. And I'm like, I don't think you should buy it. And anyway, she bought the horse, and then it had chronic uveitis issues thereafter. But she really liked the horse. So anyways, before I even get there, there's a conversation that's had with, who am I working for? Is it, ultimately it's the buyer, but the buyer may have a trainer representing them. They may have an agent representing them. Where is the communication tree? Who needs to be talked to? Is there a veterinarian involved on the buyer side? For example, maybe the buyer's from California and they're buying a horse out here on the East Coast, and there's a veterinarian in California that they trust and know, and maybe they don't know me. And, it's not uncommon to take some videos of the horse moving, doing the flexion tests, sending their veterinarian all the radiographs so they can weigh in on it. That's totally normal, for pre-purchases across distances. So, that I always have that discussion about what the expectation is and what's needed before we even get there. And then obviously we always discuss, a rough estimate of costs and what's involved with that. So, also what's the animal to be used for? Is it jumping, dressage, eventing, racing, breeding, trails? Do I just want to stare at it in my pasture? What is it? And that may dictate, not so much on the physical exam part, but particularly with the x-rays. Sometimes, you would shoot less x-rays for certain situations, or no x-rays. Sometimes there's other imaging involved. Endoscopy, which is where you put that little camera up their nose and look at their upper airway. Ultrasound, suspensory ultrasound is not an uncommon thing in certain situations at the time of pre-purchase. Advanced imaging for pre-purchase, this is a major can of worms. It gets done occasionally, but we can discuss that a little bit later. Drug testing and blood work, I always pull for a drug test, even if the client doesn't want it, and then I'll freeze it for 30 days. But as a good general rule, you should always run a drug test just so you have that information, and baseline blood work is never a bad idea. It mismatches, these kind of ridiculous photos just highlight the point of, it's really not the veterinarian's job to say that this is a bad match for you. That's really your trainer or agent or whoever you've entrusted to match you with this horse based on your riding ability, whatever. And yes, as veterinarians, we get put in these positions sometimes where there's a clear mismatch. And I will make people aware of my opinion if it comes to that, but it has to be a pretty significant case. But usually that's not our job. So anyways, the history, getting into, as much as we can is that the seller is willing to provide. So, medication history, what do they routinely get? Adequan, Legend, do they live on Equiox or Previcox for some reason? What's been in their level of work for the last 6 months? Lameness issues. Of course, they've never had lameness issues. All these horses are sound. Inevitably, that is what comes out in most of these pre-purchases. We all know that that's rarely the truth. Date of recent routine dental work, vaccines, dewormer, just basic healthcare to get that down on paper. This is a real sticky area when you get into disclosure of medical history. And, it varies state by state as far as the legality behind the requirement of disclosing a horse's previous history. Sometimes this shows up later on past the pre-purchase when there's a purchase contract, and that verbiage may come out in the purchase contract that needs to be disclosed. But it's not all the time does it need to be disclosed, depending on the state you're in at the time of the pre-purchase. You hope that it would be, but frequently it is not. Now, sometimes, this happens where there's, if I've done work on a horse and someone asked me to do a pre-purchase, or I did work on a horse and another vet in our practice does the pre-purchase, you would always ask the seller to disclose the medical history. You need to have full transparency with that, because if you're pre-purchasing a horse within the same practice, there's an inherent bias. And sometimes I'll even advise, the buyer, I say, maybe you want a completely unbiased opinion, get another veterinarian. And that way there's no bias involved with it, that doesn't know the trainer. But frequently, horses are being sold within bigger barns and under the same trainer. And in those cases, it's in the trainer's best interest to be completely transparent, because if something flares up, it's their problem. It's under their care in their barn. So frequently in those situations, most people are quite transparent. But if someone does not disclose, it can be a real sticky situation. And from a veterinary perspective, an ethical dilemma, without a doubt. And I try to avoid those situations because it never ends up in a positive way. So, when you watch your vet doing the exam, the goal of the pre-purchase is to kind of go through all of the major body systems and check the horse out, look for anything that may be abnormal or, potential risk factors for potential issues in the future. But, when you're looking for a vet to do a pre-purchase, there's a lot of vets that won't do pre-purchases, and they don't want to deal, there's a lot of headaches that go into pre-purchases. There's a lot of communication. Sometimes it's hard to charge for your time appropriately based on the amount of work that goes into it. So there's some vets are like, we don't do them. I don't want anything to do with them. Then there's other vets, myself included, that do pre-purchases and done them a lot over the years. And I know what's involved with them. I know the headaches that's involved with them. By asking the right questions and having good communication early on, you can avoid some of those. But anyways, we go through all the major body systems. So, cardiothoracic, the first thing you'll see your vet doing sometimes is listening with a stethoscope to the horse. They're trying to hear for any cardiac murmurs or arrhythmias. They're looking for nasal discharge or a sign of respiratory disease. Then, they'll look at everything in the skin. There could be masses, little areas of dermatitis, scratches, for example, super common. Areas of depigmentation, and we'll get more into that. Oral examination, sometimes these are always done. It just depends how involved they are, but obviously you're looking for dental abnormalities frequently. Sometimes you'll pick up on old tongue lacerations on some horses that frequently don't matter. Ophthalmic exam, so the big things that you're looking for are cataracts and evidence of uveitis. Those are the big things. Dr. Nickelbein can chime in with her experiences, but cataracts and uveitis are some of the most common issues that we fight in horses, and cataracts, especially if those get missed at pre-purchase, that can be a little bit sticky. Musculoskeletal exam, lameness is a huge part of that, evaluating the horse's conformation, their gait, and suitability for their intended purpose. Neurologic examination, looking at the horse's reflexes, muscle atrophy, coordination. And, reproductive exams, they're very much if someone's looking to buy a horse for breeding purposes, they would typically go to a theriogenologist for a breeding soundness exam. But general from our purposes, we look at the surface of things and say, okay, are there any masses or discolorations or things that we should be concerned about? So, physical exam, again, we talked about one of the first things that we do is listen to the heart. And, this is a common thing that comes up in pre-purchases. If you hear a murmur or an arrhythmia, what do you do about it? Which murmurs should we care about and which ones do we not? And ultimately, at the end of the day, anytime you hear a murmur or an arrhythmia, getting an echo, which is an ultrasound of the heart, and an ECG, electrocardiogram, which looks at the electrical conductivity of the heart, are indicated, at least offered and to the buyer and say, listen, this is worth getting, a cardiologist's opinion and before you make a purchase on that, especially as we're looking more into, cardiac safety, overall safety in our horses. Doesn't matter which discipline you're in. You don't want to overlook, and historically, we used to say, okay, mild left-sided systolic murmurs, most of them are unlikely to negatively impact performance. But, I was doing a pre-purchase on a horse in Europe and, there was a murmur and I told the vet over there, I said, listen, I want this worked up. I want an echo, I want ECG, and I want all of it sent to my go-to person at Cornell. She wasn't at Cornell at the time, but Dr. Mitchell, she's the best with equine cardiology. And at the time she was in Switzerland and anything that I have from a cardiac question goes to Dr. Mitchell because I trust her opinion implicitly and she's exquisitely knowledgeable. So anyways, the always offer to get all the detailed information for your buyer. And if you are the buyer, then you can make that decision saying, I want to pay for that, or I want that information, or I don't. And at least it was offered to you. Also on physical exam, we look for muscle atrophy. This usually they're not this pronounced. You would hope they're not this pronounced. But, prominent muscle atrophy could be a sign of a previous injury. One-sided atrophy like this, you can get that with horses that have had bouts of EPM in the past. So, we always look for muscle symmetry, muscle atrophy, et cetera. As surgeons and I do a lot of airway surgery, I always palpate the larynx. The larynx is the voice box in this area. You can palpate muscle asymmetry in that area. And if you hear a noise at exercise, then sometimes that's another piece of information that gives you an idea about what's going on. Surgical scars. So it's a huge area of controversy, and particularly if they get missed. But, just as a complete disclosure from a surgeon, these are very easy to miss in some horses, and especially if they're not clipped. So the big surgical scars that we look out for at pre-purchase. So, this is not a scar. This is a horse with staples in its belly after colic surgery. But it will have a scar there eventually. So ventral abdominal scars from colic surgery. Now, those can be missed, and it just depends on how that horse's body wall healed. Sometimes they can have little pinpoint hernias in here that you feel that don't bother the horse at all, but you can tell that the horse had colic surgery before. Sometimes you can palpate a little bit of a ridge of a scar, but other times it can be really difficult if they healed up really well. So that's a big one that you don't want to miss in the ideal world, and that we always feel for. Now, nerving, your vet will always test heel sensation, particularly in the front feet. They'll just touch the heels with their pen or something and say, can they feel their heels? So, there's a surgical procedure out there called a nerving. It's a palmar digital neurectomy where they actually remove a section of the nerve from, both or one sides of the foot for whatever reason. And sometimes you'll see a little scar in that area. There might be a little thickening of the skin there. And sometimes there's a lack of heel sensation associated with that, depending on how many years out from surgery it is. So that's another thing that we look for. This one is slightly less common, but This is a scar in the hind leg at the top of the cannon bone and towards the back. This one's towards the inside. You could see the same thing on the outside. This is a scar for a horse that's had suspensory surgery. So there's a surgery out there for hind high suspensory injuries called a fasciotomy and neurectomy. And the incision is right about there where this vertical black scar is. So if I see that, I'm getting clued in to really palpate that well and or ultrasound that horse's leg, looking for evidence of previous surgery. Throat surgery, as for this is my own horse. My own horse has had a tie back before I got him. So, but he's got, a little black scar here. Gray horses are amazing at showing every little scar on their body. So this is what a tieback scar looks like for a roarer. So I know what that is because I do surgery there all the time. A lot of vets may not, but that's what we would look for. It's a little scar in that area. And then the only other way to know if they've had a tieback is to put that camera, the scope up their nose and look at their airway. So again, you would hope that previous surgery was disclosed to the buyer, but it may not always be the case. Masses. This is another huge area of question mark depending on location and how they look. And the big masses that we're looking out for are sarcoids. So this is a type of skin tumor. Squamous cell carcinoma, it's another type of tumor, and melanoma, which is another type of tumor, more frequently in gray horses. So, masses in around the third eyelid, on the cornea of the eye, around the shaft of the penis or over joints or a tendon sheath or anything that's ulcerated, those all raise big red flags to me. And sometimes a seller will come to you with a biopsy report and say, hey, this horse has had this mass, we biopsied it, this is what it is. And that can be useful, but it doesn't always eliminate the risk based on what it is. Sarcoids are very good about staying dormant for potentially years, and then something gets them angry, and then they can go absolutely crazy. So this is a flat sarcoid that's relatively inactive. This is a nodular sarcoid that's gone crazy. Both can happen and can happen at any point, even if something that just caused some inflammation there could activate it. When I was talking about reproductive, so discolorations on the end of a penis, for example, this is commonly precancerous towards squamous cell carcinoma. So that's a red flag. You have to be careful about that. Evidence of tail rubbing, that could be allergies. It could be parasites. Maybe your horse just has an itchy butt. But again, these are all the things that go through my head that I make notes of, and then I gather information to provide to the buyer. Eyelid masses and things around the cornea, again, you have to be very, very careful. A mass that's a little bit higher up here versus one that is either on the third eyelid or close to the lid margin. One of the things I look at is how easy would it be to remove that mass if you're not Dr. Nickelbein, and especially something around the lid margin. If that flared up, that could be a major problem, especially if it's a sarcoid. Any kind of a fleshy mass around the third eyelid, these can commonly be squamous cell carcinoma. And yeah, sometimes removing the third eyelid gets them okay, but sometimes not. And you would hate to miss that on a pre-purchase exam. So we look for all these types of locations anytime we're doing an exam. Oral examination, there's two types. There's an unsedated type and there's a sedated type. The sedated type frequently has, a speculum involved. And, this, you may or may not be allowed to sedate the horse at the time of pre-purchase. Maybe it's at a horse show. Maybe the horse is showing the next day. Maybe, maybe the owner doesn't want you to, whatever the reason may be. Realize that if the veterinarian does not perform a speculum exam, you can miss some dental abnormalities in the back of the mouth. This horse had a cracked 06 premolar in the front of the mouth. That one's a little bit easier to see, but back here in the back of the mouth, if you're just kind of unsedated, pulling their tongue to the side and having a look, you can miss that. So I always say, if I'm not sedating them, it's a limited oral exam, and you assume the risk with that information. The ophthalmic exams, again, I told you the story about Mr. Yellow Eye. Again, kind of like the sedating for oral exams. We don't always dilate the eye at the time of a pre-purchase exam to look in the back of the eye. So dilating the eye, just like humans, they put a little bit of atropine in the eye and the pupil dilates so that you get a better look at the back. But again, depending on, maybe the horse is at a show and you can't give it atropine or whatever the case may be. So always, check in with your vet and say, and usually your vet will tell you, this is what I was able to do or not. Are you okay with that? Do we need to have more of a discussion with the seller? Uveitis, is a big thing that we don't want to miss. And at least some of the early changes associated with that at the time of pre-purchase. Other findings in eyes. So, frequently we see these corporonigra cysts. They come in varying sizes. Some of them can be larger and can be obstructive and can, make horses a bit spooky. But, there is a laser procedure to deal with these, but, identifying that is important at the pre-purchase because they can get a bit bigger. Cataracts, these can be really tricky. The smaller ones can be a little bit tough sometimes, depending on, how the horse is behaving, the lighting there, et cetera, et cetera. So you want to give yourself a chance to get a good exam done so that you can provide the buyer with as much information as possible. But, cataracts, it's not as simple as just saying, oh, every horse can have cataract surgery, because that's not true. And, cataracts can absolutely make a horse spooky, and they can be problematic. So identifying that so that the owner can make an informed, or the buyer can make an informed decision is very important. Getting into the musculoskeletal exam and looking at conformation. So, does the horse toe in, toe out? Is it upright through the hind end? This is a, upright hock stifle conformation. For me, this is a major red flag. Especially you get this trifecta conformation not infrequently, where you get straight through the hock, straighter through the stifle, dropped through the fetlock. And you have to be really, really careful with these horses that if they don't have a suspensory injury, they're more prone to developing suspensory injuries with that conformation. And that's something that I always make buyers aware of with that. But sometimes these horses have, some degree of low-grade suspensory disease or high-grade for that matter. And then we're trying to figure that out as the buyer's vet. Looking at the back and their overall muscling and their top line is a huge part of the examination. This horse here had, a subtle asymmetry between the tops of its tuberous acrali over its pelvis. You see that, some people call them hunter's bumps occasionally. Sometimes you'll see that if there's unilateral SI disease or sacroiliac disease, or sometimes there's muscle atrophy making one side look bigger. So we always kind of look for all those little pieces of information, and backs and overall muscling of the top line is hugely, hugely important. And, when I see a horse like this that has relatively poor muscling, you see the vertebrae sitting up on their top line. There's kind of a divot here at the base of the withers, right in back of the scapula. These are the horses that they should be back sore when you look at them, right? They don't have a lot of core support and back support to support a rider. So these are the horses. I mean, I palpate every horse very carefully, but these are the horses that frequently have X-ray changes in their dorsal spinous processes associated with this back finding. So we pay attention to that so that we can provide a level of risk assessment, which, if this horse palpates sore in its back with this kind of muscling, that can be a bit risky for a riding horse. I should say the caveat to risk is also what level of riding are you planning on doing? For a horse that needs to walk on the trails versus do Grand Prix dressage, those are two different things. And there are a lot of findings that I'll see that may be acceptable for walking on the trails, but not as a Grand Prix dressage horse. Other conformational things that we see not infrequently, so club feet. Usually not this severe, but these can be a chronic management issue, so it's important to identify them. Club feet, a lot of them can be maintained, and for the mild to moderate ones, with appropriate trimming and shoeing, and if you have a good farrier that's used to dealing with these types of more upright conformational abnormalities, recognize that club feet cause abnormal stresses in the foot. And frequently these horses land toe to heel, they grow a lot of extra heel. They don't have quite normal shock absorption through the frog, and there's increased stresses in the foot and the coffin bone. So it absolutely can cause lameness issues, but appropriately managed with good trimming and a good farrier, a lot of these horses can be sound and perform at the top level. Sheared heels, where you've got, oops, there we go. Sheared heels, when you've got this kind of asymmetry in the heels, again, that may be evidence of a lameness or the way the horse is loading. That may be evidence of how the horse is growing asymmetrically. It may not be, oh, the farrier trimmed this horse, inappropriately, and therefore it's got a sheared heel. I mean, this horse may be chronically growing asymmetrically, and that's the way it's manifesting. So most horses grow asymmetrically in their hoof wall. So it's your job to figure out, okay, what is manageable and what isn't, what's more likely to cause lameness issues. We look at the types of shoes that horses have on their feet, if they have any shoes on at all, very closely. A horse like this, for example, this side of the shoe is slightly wider than this side. Frequently that gets done because they're trying to provide more support to this side of the foot. For example, if the horse had a collateral ligament injury on this side of the foot, this is one type of shoe that you would put on that. Egg bar shoes, full pads, wedges, more prominent wedges. This is a flip-flop shoe. Sometimes horses with heel discomfort can get put on those. This is, obviously a major, this would need some explanation if you picked up the foot and you saw kind of a big bar across the bottom requiring that much support. So, but, again, frequently, if a horse has glue-ons or another type of shoe, frequently the seller will say, well, this, here's our reasoning for putting the horse in these. And, so you have that information. But, glue-ons, sometimes, hunters, for example, may go on glue-ons because they move better, they're lighter. But it may be another reason. The horse may have chronically poor hoof walls and they can't take a nail. They may have thin walls so that they get sore, every time a nail gets thrown into their foot. So recognize that horses with glue-ons can have more brittle hoof walls over time, and they're more expensive to maintain, for what it's worth. So then you'll see your vet, running around with hoof testers, squeezing all of your horse's feet, or prospective horse's feet, looking for evidence of bruising. This horse had a little bit of heel bruising in this area, and then it was reactive to hoof testers over that area. We look for quarter cracks. This is obviously more at the extreme end, or any little patterns of sensitivity, so that if you see something when the horse is when you're going through the dynamic exam, the lameness part of it, if you see something, you can then correlate that with the piece of information you got in your physical exam. So we palpate every aspect of the horse's body, particularly over the joints and tendon sheaths. This horse has a little bit of increased fluid in its fetlock joint here. This horse has a little bit of increased fluid in its tendon sheath. This is this horse clipped because it's going to surgery soon, but this horse, obviously has a ton of extra fluid in its top hock joint. So, effusion may be a sign of pathology, or it may be a sign of, maybe an older horse that works hard for a living and it's got a little fill in some of the joints. The one caveat to that are tendon sheaths. People are like, oh, this horse has wind puffs, the hind legs. So wind puffs are, some tendon sheath fluid in both hinds typically. If they're on both hinds and symmetrical, non-painful, that's one thing. But if it's unilateral, meaning one side, that also raises a little bit of a red flag, is could there be some pathology developing in there? Thick and soft tissue structures, little bump over the check ligament, be careful. Some horses have had previous check ligament surgery. So, when they're diagnosed with bad club feet as youngsters, there's a surgery where you can actually cut this ligament to help relieve some of the stress on that foot conformation. So sometimes you'll pick up on that at the time of pre-purchase. I think there's a little bit of increased risk with horses that have had that surgery with upper level jumping, for what it's worth, if I pick up on it at pre-purchase. Palpate thick areas of thickening. This is a horse with a suspensory branch injury in that side. So, thickenings around the fetlock, it doesn't matter where it may be, but, all those should be investigated and at least an ultrasound offered to further investigate that. Splints. Splints are very common, for the ones that are smooth, non-painful, on the smaller size, they don't usually bother me unless it's, the buyer is looking for a conformation type horse. For larger splints, larger bony calluses, you're worried about something called a blind splint, where the bone, goes inside. So the splint, the inside and outside splint bone are on either side of the suspensory. So when you get a large bony proliferation, that can go towards the suspensory ligament. So sometimes we'll ultrasound looking for that. But I've also had horses that, have had repeated splints in all four legs. I look for conformational abnormalities in those, or horses that routinely fracture, their inside hind splints, and that may be related to the way that their foot path is, the way they carry themselves. Neck range of motion, just a routine part of assessing. This was winter time at my previous job. I wasn't at a Justin Bieber concert. But anyways, I look at neck range of motion on every single horse, and a normal neck range of motion like this, they should be able to reach all the way around readily if you give them a little treat or something. Any kind of delay in getting you that range of motion could be a hint at some underlying pathology in their neck. And again, palpating their back really well, as we talked about, depending on the sensitivity of the horse, some horses are very touchy, and whenever you touch them anywhere in their body, they flinch and they jump. Other times it's because they're sore. Like this horse was getting a bit shifty, even just me getting near it. And this horse was fairly back sore. So then, those horses all offer radiographs and a little bit more investigation into that region. So the dynamic examination, again, we look at them on a walk, trot, canter on a lunge line, if appropriate for the age and breed of the horse, and then after they've worked a little bit, gotten their heart rate up, their respiratory rate up, do they nostril flare? How well do they recover? What's their heart sound like after work? Some murmurs show up after exercise, or they're more obvious after exercise, I should say. We'll go around and we'll flex, all the limbs and watch them jog off, looking for areas of soreness. And, I'll watch them on hard ground in a circle. I'll watch them on soft ground, and ideally, watch them under tack at the same time, because there are certain things that really only manifest under tack. And if you're doing a pre-purchase examination, really you should watch a horse move under saddle. And, this horse drags its left front toe with the rider on its back. It wasn't doing that without the rider. And I was then clued into kind of looking at the wear pattern on its foot. And yes, this has been more of a chronic thing. This horse is part of a pre-purchase. It's, just part of the routine of watching it evaluate on the lunge. Looks pretty good on the lunge line. And then when we watch it on hard ground, and I don't know if it's a little bit staticky for you guys, but anyways, if you can't see it, you can hear it. And, this horse is lame on the right circle on the right front. And, I've gotten in a lot of arguments with friends of mine in the show world about, circling horses on hard ground, especially horses that show a lot, work a lot, etc., that frequently you can make those horses limp just because it's a tight circle on a very firm surface. So I always give horses a little bit of the benefit of the doubt if they look great on soft ground, and then there's a hint of unevenness on hard ground. But this horse is quite sore, and it was sore to hoof testers. So that was the end of that one for that exam. And then we go through and, like I said, we'll flex, all the various joints, looking for different areas of soreness. And this video is just highlighting that, depending on the discipline that you're doing a pre-purchase on, you want to see that horse working in its, anticipated conditions. So, if that means driving them under the appropriate tack, then do so. You want to try and recreate regular conditions as much as possible. Before I would ever sedate a horse for x-rays, for example, I always ask permission, but if the buyer wants me to scope them, so to put the camera up, evaluate their airway, you want to do that before you sedate them, because the sedation will affect their ability to open and close their, these are called the arytenoid cartilages. So a horse that's a roarer, usually the left side has decreased function or is paralyzed completely. It just depends on the grade of it. So scoping them will identify that. Frequently, these horses will have a noise when you're working them. Sometimes you pick up on weird stuff in the upper airway that, you wouldn't know if you didn't look. So, and sometimes the seller didn't even know it was there. But I always run baseline blood work, CBC and chemistry, and then pull a drug screen. Most clients will want it run immediately. Some will want it run, I'll hold it at least for 30 days and then go from there. Lyme and EPM testing. This is a huge area of controversy. It's done not infrequently in my area. I don't recommend it unless there's a clinical reason to really check in that. It's very difficult to interpret that, as a lot of these horses will have low positives on both EPM and Lyme, and that's consistent with previous exposure. So, and then that turns into, so then what do you do if a horse has a low titer, but there's no clinical indication of disease? Then there's, kind of ridiculous things happening, like people trying to negotiate, 30 days of Lyme treatment, which is typically doxycycline or minocycline, or, if there's low titer on EPM, marquee treatment, which is absolutely ridiculous frequently. But they're trying to negotiate that into sometimes the pre-purchase contracts, which I think is very, very sticky to get into. If there's a clinical reason to check, if owners like my horse had Lyme 6 months ago and you want to recheck it, by all means. But as a routine thing, I don't recommend it. There were some questions before about international pre-purchase exams. I do a fair number of these, and the key to them, most of the ones I'm doing are in Europe or around that area. It's finding a good vet, in that area that does, it sounds stupid, but an American style pre-purchase exam. When I say American style, it really comes down to the x-rays. In Europe, they frequently don't shoot as many x-rays as we do in the US. And I would say that we over scrutinize our x-rays, both from a positioning and a quality standpoint, as a general rule. I've seen plenty of bad x-rays in the United States. I've seen plenty of bad x-rays in Europe. But it's much more difficult if, again, it's that California, New York thing I highlighted before. If I'm taking x-rays for someone else to interpret them in another country, I'm going to send them the best quality x-rays that I can possibly take. And frequently that is not the case, depending on who you're working with. And then that makes your job, as the person working for the buyer, really difficult, because you can't make a really informed decision based on poor quality x-rays. So anyways, there's some ways around that. So people always ask, they say, well, what x-rays do you want? And WhatsApp is a beautiful thing. Frequently, most international pre-purchases, a lot of the communication is done via WhatsApp. So I'll WhatsApp a list of the x-rays I want to the vet over there. And, frequently the conversations is going through an agent or maybe a trainer on the other end. But, usually WhatsApp is a safe way to send over in writing what you want. And, if they send a set over and you're not happy with it, if it's a few x-rays that or maybe you see something, you want another shot, I'll ask them, for another x-ray or two, and I'll say, we'll pay for you to go back, take more x-rays. And if the entire study is poorly positioned or poor quality, I'll go to the buyer and I'll say, it's not worth using this veterinarian, which is sticky. And sometimes, I get my, names yelled at me, et cetera. But at the end of the day, I'm working for the buyer, not the veterinarian in Europe. And I'm not trying to, make enemies around the world, but at the end of the day, we're working for the buyer. And if we can't get a decent set of x-rays for what we're paying them for, then we need to find someone else who can. And I've run into that situation a number of times. So we're going to get into x-rays as we get to the latter part of the talk. How many? And it really depends on level of information that the client wants. It may be based on how much money you're spending. It may be based on a previous bad experience, the navicular person, for example, a full set versus a limited set. Again, there's a lot of things that go into that. A full set, is about 40 to 42 x-rays for most sport horses. 4 views of both front feet, 4 views of all 4 fetlocks, 4 views of both hocks, 2 views of each stifle, and then lateral views of the neck and back. Sometimes we'll throw in a lateral view of each knee, carpus as well. That gets very expensive. That may not matter depending on the price point of the horse, but if it's a cheaper horse, some people don't want to spend that much on x-rays. And sometimes they'll say, okay, what are the hot spots that I want to screen? So sometimes that might be front feet, hocks and stifles, or something else based on a bad experience that person has had. Remember that x-rays, this is where you get into that kind of crystal ball scenario. We're trying to make a prediction about, is this going to cause a problem or not? And it's, again, level of risk, not you're good or you're not good usually. And a lot of vets will do a grading system, to try and designate severity of certain changes. Navicular is such a horrible word. And so the navicular bone exists in the back of the horse's foot on all 4 legs. And there's a huge variety of, particularly what the lower distal border of the navicular bone can look like, with something called little synovial invaginations or vascular channels in there. So huge variety, all of which, some of which may be pathological and some of which may not be. And, the tendency has been, as an industry in the vet side, to be more lax on navicular bones because they frequently poorly correlate with the findings that we're seeing on MRI, unless there's something big. This is a big cyst in a navicular bone. You don't want that. Big lucencies like this, sometimes those are big red flags. But, case in point, these are 2 horses that have normal, in my opinion, navicular bones outside of maybe a little shape irregularity. And then when you go on, these horses are lame, quote unquote, my horse has navicular, normal bones, but on the MRI, they've got huge deep flexor injuries. So remember that it's not as simple as just saying, I want a normal navicular bone. There's a lot that goes on in the horse's foot that you can't see without an MRI. Now, you're not going to do a pre-purchase MRI. Presumptively, these horses are sound, but recognize that there's a lot more that goes into it than just saying, I want, a quote unquote normal navicular bone. Conformational things that we look at on x-rays would be the angle of the horse's coffin bone relative to the pastern in the foot. So this is what's called a negative hoof pastern axis. When a horse is negative like this, meaning that the heel of the coffin bone is closer to the ground than the toe, these horses are prone to heel bruising, increased soreness in the navicular bone. Frequently, they wouldn't be this bad at the time of pre-purchase, but something more subtle like this is totally possible. Something that's a little bit more flat in their angle or a hair negative. And those are all things to know, because not necessarily to say, okay, you need to get turned away, but these are management things to address with your farrier. Calcification of the collateral cartilage or side bone, comes in a variety of different shapes and flavors. Frequently, the really big ones are a sign of some kind of abnormal mechanics in the foot. But, a lot of horses can be completely sound with these, but I've had some that have fractured, and then those horses can be really lame after that. So you just have to be a little bit aware when the vets see this and make a note of some side bone on the x-ray. Trying to identify horses that have had previous laminitis episodes, because frequently, that's not disclosed as, oh, this horse has had laminitis, because usually people wouldn't come to look at them. So if it was an honest seller and they said, hey, this horse had laminitis, here's all the information, then great. But that's frequently not the case. So things that we look for as vets, sometimes a little bit of remodeling, these little like lips you see down at the tip of the coffin bone. We'll look at the thickness of the hoof wall dorsally here. We'll look for evidence of rotation, which can be a little bit sticky because some horses that are long through their toe can make it look like they have a little bit of rotation in their position of their coffin bone. So it's not completely straightforward, but sometimes we'll say, okay, there's some mild changes there. One of the differentials could have been a previous bout of laminitis. And there's obviously a lot of reasons that could go in for a previous bout if they disclose that they would need investigation. There's a question about arthritis and, what arthritis is acceptable, what isn't. It's a good question. I mean, high motion joints, coffin joint, fetlock joint, stifle joint, top joint of the hock, top joint of the knee, those are all high motion joints. And when you start to get arthritis in a high motion joint, those are frequently problematic, from a management perspective. Now, this is pastern joint arthritis, and pastern joint arthritis can be a big problem to deal with, even though it's a relatively low motion joint. So, there's always risk in these types of findings. Now, things that may help you is if the seller has x-rays from several years that say this has been a static change. That doesn't mean that you're scot-free, but it at least makes you feel a little bit better. And maybe if you find something, the seller would disclose what they've had to do to manage this. Might be nothing. They may say we inject it once or twice a year. Maybe the horse lives on an anti-inflammatory, whatever it may be. But I always think about the worst case scenario, which is if this goes bad, what are my options? Assuming that, it's been injected, et cetera. And so I look at the joints of, is there a surgical fix to the problem? And it's not that, as a surgeon, I always evaluate this and there's more to it than what meets the eye. But, fusing a fetlock joint does not have any kind of athletic expectation with it. Fusing a pastern joint does. You can fuse a pastern joint and expect a horse to go back to, exercise, sometimes even at a higher level. You cannot fuse a fetlock joint and have a horse go back to exercise. So, think about the joints that are involved. And if worst case scenario, the unimaginable happened, which is this horse is chronically lame after I bought it, what are my options going to be? And that helps you assess level of risk as you go through with it. Lower hock joints are another one that have a potential option for surgery, but there's a lot more that goes into that than surgery is the fix. So just some common things that we see, little changes in the lower hock joints. You'll hear vets say there's a little remodeling there, remodeling the hock joint, or a little lipping in a hock joint or something like that. We just look for, adjacent changes in the bone. How big is it? Does the horse flex positive in that area? Is there any baseline lameness? And all that goes in, but frequently we're fairly forgiving for, mild to moderate lower hock joint changes. Even though it's a little bit blurry, you can see there's some fragments in here. There's a fragment here in the coffin joint. There's a fragment here in the pastern joint. Fragments can contribute to inflammation and then osteoarthritis development. So you have to think a little bit about where that fragment is to then say, okay, what is the likelihood of that causing a problem? And is surgical removal an option, based on that? Sometimes you would hate to buy a horse knowing that it needs to have surgery immediately, but a lot of people do that. Fetlock chips are common, little OCDs or developmental chips that, they get as youngsters. There's a lot of these that are small, they're on the smaller side, smooth, round, that frequently don't cause a problem. And, it's a relatively easy surgery to remove them if they become a problem. But this one, for example, is just a small chip in the front of a fetlock. It's an OCD, which is a developmental chip. And, it was causing lameness in this horse. They blocked, the lameness was blocked to the joint, meaning they put local anesthetic in the joint and it relieved the lameness. And then when I went in there arthroscopically, there's the chip sitting on the front of the first pastern bone. And then the cartilage on this side of the lower cannon bone was all irregular and fibrillated. And so these chips that, sometimes vets will say, oh, these are innocuous. It's not always the case. This is what normal cartilage looks like. Beautiful, glistening, smooth. And when you get this kind of like irregularity, that's from chronic inflammation in that area. And sometimes you'll get little erosions from these chips. So they're not all innocuous. Some can cause issues, but a lot of them, if they're smaller, smoother, and round, a lot of them don't cause major problems. But anything that's multi-fragmented, these all need surgery. Horses that have had surgery, especially in hock OCD cases, if it's up in this area in the distal intermediate ridge of the tibia, for example, I'm okay with most of those. They usually do just fine. Some horses have little chips there, but as long as they don't have inflammation in that top joint at the time of pre-purchase, I'm okay with it. Be careful of bigger stifle chips. It's a big high motion joint. And horses that have had, larger chips removed from the stifle, sometimes that can be problematic. Cysts, cysts are not like those little, fluid filled things that are on your dog. These are bone cysts. So these are areas of lytic bone or bony voids. They can be close to joints, or they can be other parts of bones, but cysts that get picked up that are near joints are usually major red flags, high risk for most of them. Frequently, they have little articular communications and can result in, the horse may be sound at the time of pre-purchase, but if it goes bad, it's going to go really bad for most of these cases. So cysts I try to avoid if possible. Stifle cyst, for example, is not an uncommon finding, or varying degrees of flattening in the inside aspect of the stifle. Even though there's a surgery we do to fix these, sometimes there's some damage that goes in if it's an older horse that's present because of these cysts. So we'll investigate that a little bit more. Just a few more slides. So these are x-rays of a back, dorsal spinous processes, the dreaded term kissing spine. I say dreaded term because there's way more that goes into it than how it appears on the x-ray. There are horses with very narrow spacing in their back that have great muscling, no soreness. And so there's a lot of anatomic variation that can go into how this appears on an x-ray. The ones that I pay attention to a little bit more are the ones that have, bony resorption around the back combined with poor muscling. That tells me maybe that horse travels a little bit hollow in its back and it's putting a little bit more stress on its back, and that could be a problem. Sometimes you pick up on just random cool mineralizations that, frequently can be a little bit hard to prognosticate on at pre-purchase, but sometimes you'll pick up with them on x-rays. On neck x-rays, we see this more and more, little random mineralizations, which frequently we think that maybe this was someone who tried to inject the neck previously, and these are the joints of the neck facets. Sometimes that could be inflammation from an injection, that could be something else. So we always pay attention to that, to look at the neck facets for evidence of arthritis or enlargement. This kind of mineralization, this is coffin joint disease that I got on a pre-purchase with a horse that's got pretty significant coffin joint disease. Actually, it's a upper level dressage horse. And then, just a couple random scenarios. Withers fractures, horses that flip over and they break their withers. You know what? Usually once these heal, even though they can heal sideways, usually these horses do okay. And the only caveat to that is they can be a little bit tricky to fit a saddle to, because they can be a little bit broader through their withers than your average horse. But, this wouldn't turn me away if it healed and the horse was doing fine after it. Suspensories, again, some people want, baseline suspensory ultrasounds done on their horses at pre-purchase. Calling a suspensory normal for most warm bloods can be a little bit challenging. I think depending on the size of the horse, they can have, larger suspensories, but sometimes you'll pick up on clear abnormalities where they attach or at the origin that may suggest some disease process that you need to look out for. And frequently when you find these types of things, or any finding on a pre-purchase, this is a horse that I was lame at the pre-purchase, and then it was sore when I palpated its suspensory and I ultrasounded it, and it had a fairly thick suspensory difference side to side. So I told the buyer, this is high risk. it's lame, I wouldn't buy it. As one of the rare instances where I'm like, I really wouldn't buy this horse. And then, then immediately the sellers, I don't know what I'm talking about, and you should get, name calling, et cetera, et cetera. And I'm like, that's fine. Your horse is lame. We'll move on. So anyways, do your due diligence and you can find some things. Now, sometimes a horse may have a thickened suspensory, but it may not be lame. And, that may be okay. You just have to take all the pieces of information with it and move on. So, in conclusion, can we predict the future on pre-purchase? Absolutely not. It's, buyers frequently want us to, and sometimes get very angry if something, goes the wrong way, despite the information that was provided. And that's why a lot of vets don't do pre-purchases, honestly. But, recognize it's a snapshot in time. And as long as you have a vet that's very detail oriented and provides you with as much information as possible, then it's on you to make a decision about how much risk are you comfortable with in the purchase. And that may be buying a lame horse, that may be buying a horse with a yellow eye, and for whatever the reason. But then it's really, the risk is then on the buyer. Sorry, that was a lot, but we can just take a minute and I'd be happy to answer any questions that I can and go from there.
Awesome talk, Dr. Pigott. That was wonderful. You really touched on all of the different facets of the pre-purchase, and I think people probably realize now how complex these exams really are. There are a few questions in the Q&A here that we'll go through. We can pose the questions to you and then have you kind of give your answer. So a question about horses seem to be staying in work to a bit of an older age now. Is there anything specific that you look for when you're pre-purchasing an older horse?
Yeah, I mean, older horses. So, older horses are more prone to developing things like Cushing's disease and looking for some of the, so I may ask the question, has this horse ever been tested for, metabolic disease or Cushing disease, in its past? And then maybe look for some of the signs with that in the pre-purchase that say, is this a thing or not? Some horses can have abnormal Cushing's blood work, but look totally normal. So that's just one thing that is an age-related thing. Other things that, older horses, especially horses that have been working, they're going to have changes on their x-rays. If you x-ray my knee, you're going to see stuff for sure. And I feel okay on my knee right now. So, realize that, this hunt for the perfect set of x-rays it's just really unattainable, a lot of the times. And, older horses, it really comes down to, okay, here are the findings that may be present on the x-rays or on the exam. How has the horse been performing with that? Has it had any big breaks from work, in the last 5 years? Has it been competing at the same level? Has it, that's more important to me than one specific x-ray finding. So I always take that hand in hand. And the one thing that older horses have over younger horses is, especially if it's been with the seller for a longer period of time, is time. Is that works to your favor. They can say, I've had this horse for 5 years or 10 years, and it's been basically sound, or these are the issues it's had. So, I'm not opposed to older horses at all. It's just you have to look at them slightly differently, but sometimes that works to your favor.
Awesome. Thanks for that. Are you currently recommending any genetic testing when you do a PPE? There's a question specifically about PSSM1 in warm bloods. Are you recommending any genetic testing currently?
I don't. You could genetic testing that's out there, if you're in the quarter horse market, looking at some of the different genetic mutations present in quarter horses, and specifically with PSSM, I'm not, if the client wanted to run, a blood test or something like that, I'm happy to do it as long as the seller is okay with it. But no, I don't routinely run PSSM testing because, honestly, I think that can be a little bit hard to judge. Most warm bloods are out there that are on, a relatively, I would say low carb diet, higher fat, which is the treatment for most of these PSSM cases anyways. And, unless they were like, I saw something on my clinical exam that was consistent with, muscle spasm, muscle tying up, stiffness, poor recovery, something like that would point me in that direction, then no. Or if the client had a bad experience with the case and they wanted it done.
Great, thank you for that. A question about cellulitis. Is there any good way to tell if a horse has had a previous episode of cellulitis if it's not actively having a cellulitis flare-up on a pre-purchase?
Yeah, it's a great question. Cellulitis is one of those things that, once you've had one or two really bad bouts of cellulitis, you are absolutely more likely to have it again, right? And if the horse recovered, now, if the horse has had, I would say a few bouts of bad cellulitis in the past, frequently their leg doesn't come back down to completely normal size. So, if you're palpating the leg as the vet and you're like, this leg is a little bit thick, that may be one red flag. It depends a little bit. If they did not disclose that the horse had cellulitis in the past, I'm not sure I could look at the leg and say, oh yeah, this is a horse that's going to have cellulitis. Now, sometimes you'll have horses that have, really bad, especially this time of year, horses coming back from Florida, bad scratches or dermatitis in the back of their heels. And if I see that on a pre-purchase, I might say, listen, we need to be careful with this because that could flare up and turn into cellulitis. But yeah, trying to pinpoint the horses that are going to be chronic recurrent cellulitis cases, really it comes down to size of the leg. And if it's a big leg and they tell you it's had cellulitis before in that leg, that would make me a little weary. Because that, anyone that's dealt with bad cellulitis before knows how much of a pain that can be for the recurrent situations, for anyone for that matter, that's included.
All righty, thank you for that. I think we'll finish up with one more question here just because we're getting a little bit late in the evening. We can kind of collate the rest of these questions and try and get you guys some answers. And if you didn't type a question in, but you have one, feel free to reach out to us. Any advice for if you want to do a pre-purchase on a horse that's distance-wise far from you and your personal vet can't be the one to do the pre-purchase? Any advice for finding a vet that you can, trust to give you an honest opinion on that horse?
Yeah, I mean, that's tough because it's frequently word of mouth and people's prior experience. So, if you're going to a country that your trainer in the US has no experience in that country, you don't have any experience in that country, and you're going in there blind, that can be challenging, for sure. And I think the best thing you can do is reach out to people, colleagues, friends, other trainers, other vets, whatever it may be, and see if anyone has any points of contact in the country that you're looking for, that you're hunting in. So, at the end of the day, your local vet will probably evaluate the x-rays, your local vet will probably evaluate the videos, but you're not there. So you can't, looking at a video is not the same as being there and doing the full pre-purchase exam, palpating the horse and doing all the fun and doing all the examination. So don't rely on your local vet to say, yeah, look at this video and give me the yay or nay. A lot of times we look at the x-rays, and we'll look at the videos and give our opinion. But at the end of the day, we need to rely on the vet on the ground, to give us good information. So no, there isn't like a website you can go to that's, go here to get a vet that gives you a good set of x-rays in an exam. But word of mouth is the best way to do it.
Alrighty, wonderful. We will wrap up there in the interest of time. Thank you again, Dr. Pigott, for the really wonderful talk. It was fantastic. And again, if there's any questions, feel free to send them our way. As a reminder, our next meeting will be on May 16th with Dr. Toby Pinn. Thank you.
Thanks so much.